Good morning. My name is Ruben Barr. Can you say your name for the record, please?
Good morning, Ruben. My name is Christina Perth.
And what is your candidate number, please?
My candidate number is 251124198.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
Share your nursing experience and satisfying moments.
I have worked in all critical care areas, from emergency to the cardiovascular ICU to the general systems ICU. I now work in the post-operative care unit and I have 10 years of experience. I get to make a profound difference every single day. That profound difference is different for every patient, depending on what they need from me at their time of need. That could be something simple, like holding a hand, letting them cry on my shoulder, giving pain medications. So, their loved one is comfortable, or just reassuring them that we will take care of them.
Being a nurse, what makes you proud?
I love the pride I feel in my work. Being a nurse is one of the most challenging jobs someone could do. It's physically and mentally demanding at times. However, at the end of the day, you feel amazing satisfaction and pride. Being able to help those in need for a living is unlike any other profession.
What do you enjoy about a nursing career?
I thoroughly enjoy caring for my patients and love mentoring new nurses. The things I love most about being a nurse include the variety of areas to practice in, the constant opportunities to focus on others, and those 12-hour shifts.
What motivated you to choose this career?
I chose a nursing career partially because I loved biology and anatomy, and partially to have a career with which I could support myself and be independent. The further I got into my nursing education, I realized how rewarding it was to be able to make people who are sick and uncomfortable feel better, even if it's just a little. Treating people with kindness and respect goes a long way. I found my nursing career home in hospice. It hasn't always been easy, but it has always been worth it.
What are some of the things you love most about being a nurse?
I have loved empowering and supporting patients and families to know that they are able to get through anything. Working for a hospice agency, I have been able to help patients have dignity at some of the most vulnerable times in their lives. Being with patients and their families at the end of life is a privilege. It has been an honor to have been with so many at that time.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good afternoon, Ruben Barr. How are you feeling now?
Who are you? Where am I now? I want to see my daughter.
Ruben, my name is Christina Perth. I'm one of the registered nurses in the hospital. You are currently in the recovery room after knee replacement surgery.
I am not able to recall anything. Please help me. Where's my daughter?
Ruben, just relax. Everything is fine. You were having a knee replacement surgery. Surgery was completed an hour before. It was successful, and now, you are in the recovery room.
Nurse, how am I now? I'm feeling exhausted.
You are perfectly all right. What you feel right now is due to the effect of general anesthesia. But don't worry. It won't last longer. Once surgery is done, and anesthesia medications are stopped, you'll slowly wake up. You may probably feel groggy and a bit confused.
Yes, but I want to see my daughter now. Where is she, now?
Ruben, I really acknowledge your situation. There is nothing to worry much about. Your daughter is waiting for you in the post-operative ward.
Ask her to come here. I want to see her now.
I am really sorry, Ruben. I could not allow your daughter to visit inside the recovery room.
Why? Please understand my condition.
Yes, I do realize your concerns. After doctor's checkup, you will be shifted to the post-operative ward. And there, you can meet your daughter. Is that okay for you?
No, not really. Because I am really unsatisfied with what I am experiencing right now.
I'm very sorry, Ruben. Our hospital policy won't allow any visitors to be here, in the recovery room, as it affects the health of other patients. The recovery room is a sterile area, where you are kept to assess for any signs of allergic reaction, due to anesthesia. Please be patient. Once you're stable, you'll be shifted to the post-operative ward shortly.
All right, I can adjust with what you are saying. But somehow, I need a cup of tea. My mouth is dry.
I appreciate your concern. However, when your body awakens after anesthesia, your digestive system also needs some time to adjust. Filling your belly with foods, or oral fluids, shortly after surgery, may cause you to feel nauseous, and might lead to vomiting. That is the reason why you have been provided with IV fluids after the surgery.
My goodness. How long I need to stay without any oral food?
Not much long, but you have to wait until the doctor comes. Your doctor may allow you to have lemon lime soda, juice or plain crackers, or else a warm coffee or tea, but you should not have anything else by mouth, for at least a few hours, after you awaken from anesthesia.
This is ridiculous. At least, please let me see my daughter.
Ruben, I can understand your frustrations. Please listen to me.
What should I listen to?
What I am saying right now is to improve your condition further. We have informed your daughter that you will be shifted to the post-operative ward after the doctor's checkup. So, she is waiting for you at the ward.
Thank you. But how long will it take?
Hardly half an hour.
Another half an hour.
Yes, right now the doctor is in the operation theater and he will be back in 30 minutes. Once after the doctor's checkup, you will be shifted to the post-operative ward.
This delay and isolation is making me more nervous.
Don't be panic, Mr. Ruben. As I said before, you are perfectly all right. Your surgery was uneventful. The confusion and drowsiness that you are feeling right now is just because of anesthesia. However, there is nothing to be alarmed about. These issues will be resolved in a few hours.
No tea. No visitors. Please, make my shifting fast.
Ruben, I assure you that you will be shifted to the ward shortly. Meanwhile, I'll inform your daughter to get a cup of tea for you.
Okay, and if you don't mind, kindly let the doctor know about my situation.
Yes, sure, I'll inform the doctor about your situation. Can you please wait for a while? Is that okay for you?
All right.
Thank you, Ruben. Thank you for your cooperation.
Please make the things faster.
Sure, I will do my best. Thank you for listening and understanding me.
You are welcome.
Okay, Mr. Ruben, if you need anything, please press the call button near to your right-hand side. We will be here to help you.
Sure, thank you.
You are welcome. Get well soon.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.